shed more light on the issue is Dr. AKINSANYA Olusegun-Joseph, a consultant cardiologist at the Lagos University Teaching Hospital. Dr. Olusegun, you're welcome to the program.
Thanks for having me.
I want to begin by asking you, what is heart disease?
Well, heart disease is a set of diseases that affect the heart. Alright, but then in real meaning, what we tend to talk about is cardiovascular disease, which involves diseases of
Daddy!
That is what is accepted, globally. Cardiovascular disease, which is a which are diseases affecting the heart and the blood vessels.
Heart disease, according to statistics, is said to be on the rise. What do you think is the cause, most especially in developing countries like Nigeria?
Well, there are a lot of factors that affect heart disease, and there are a lot of factors responsible for this rise. Mainly, the lifestyle that we tend to adopt now. Many people are adopting more of westernized lifestyle, increased salt intake, reduced activity. There are more sedentary lifestyle, more intake of food and substances that are very rich in fats. All these tend to add on to increase heart problems. And of course, obesity is also on the rise. It's also a major factor.
Was there any particular group that at the risk for getting the disease at this point in time?
Yes, there are. Well, the older you become, the more likelihood of having heart disease or cardiovascular disease. The more obese a person is, the more likelihood to have it. People that have parents who have heart disease, parents who are hypertensive, parents who have cardiovascular diseases, the offsprings are more at risk of having heart disease. And of course, also some other risky behavior, smoking. Smoking is a big problem in the Western world. It is also a problem in this part of the world.
Since it is established that the kind of food that we eat also, put us at risk, what is the ideal diet?
Well, the ideal diet is actually, diet that are rich in heart-friendly substances. And what we tend to talk about is, one, you need to reduce your salt intake. Alright, reduce salt intake. Take more of course, balanced diet cannot be overemphasized. Alright, carbohydrate, protein, fruits and vegetables and the rest cannot be overemphasized. Coupled with it is the fact that the salt intake in the food we eat should also be greatly reduced. Alright, take more fruits and vegetables, which are very good for the heart. Alright, and then less of fatty meals. Of course, fast foods are also on the increase here, and we tend to discourage them because they are more salty and they are more laden with fats, saturated fats.
Is there any kind of our local food which you think also contributes to the disease?
Well, the truth of the matter is that most of our local dishes are quite good. They have a lot of fibers. They have a lot of nutrients as well. Unlike the packaged food, most raw materials, raw foods that are prepared are better than processed and packaged food. So we have an advantage there, and that's why before this era, when our fathers and forefathers, were taking most of the delicacies from this part of the world, they hardly came down with these kind of problems as much as we have it in an explosive manner now. Because they tend to take fresh things. They tend to take things that the system can undo. Alright, food rich in fibers. Gari, semovita, rice locally, even the locally made rice, they're quite good. And of course we are blessed with vegetables as well. Those are very good things. Unfortunately, we are moving towards the Western, kind of food and kind of life. lifestyle, and as we imbibe them or import them in quotes, all right, we also attract some of these diseases and its sequelae.
Are you of the school of thought that we should go back to those kind of local foods?
Certainly. They are very heart friendly. They are also friendly to the immune system. Okay, unlike these other Western, and of course, even when we talk of cancers, our own local dishes, okay, quite a number of them reduce cancers, especially the gastrointestinal cancers.
Okay, and then in this case, how important is the intake of water?
Well, water is a universal substance, and of course nobody can do without it. There's the popular song by somebody here in this nation that water does not have any enemy. Of course, we use water even to prepare our meals, all right, and of course we need. The truth of the matter is that more than 60%, about 70% of even the body constitution is made up of water, and that tells you how important water is. One cannot survive if you are dehydrated severely. It's a potential death.
How much water are we supposed to be taking daily, and how does it control or prevent somebody from falling ill of this kind of disease?
Okay, well, the truth of the matter is that the level of intake of water that you have, that you take, actually depends on your level of activity to a very good extent.
Okay.
And of course, it also depends on the climate in which you are in. All right. For us here in very sunny areas, we will tend to take more water because we lose more from the skin. All right. So we need to take more water. What we advocate is that at least you should take, per meal, you should take water, at least a glass or two after meals. All right, and then also in between meals, all right, that will help to compensate for this what we call insensible loss, and that's the loss through the skin, especially on sunny days. Now, the fact is that if you take up to 2.5-3 liters of water per day, that should be good, but of course it also depends on the climate. It can go higher than that, and of course with activity, if you're a very active type, it can also go higher.
Okay, you also made mention of the fact that the need for us to take low salt daily is important to prevent this disease. Why?
Well, salt is both a friend and an enemy. The fact is that salt will make your food more appealing, and that's why we tend to put it in our meals. But then salt has very much deleterious effects on the heart and the blood vessels. It tends to retain, it encourages the retention of water in the system. It increases the possibility of the blood vessels constricting, that's getting smaller, thereby increasing blood pressure. And of course we know that elevated blood pressure, which is also called hypertension, all right, is one of the leading causes of death globally. It is the commonest chronic illness of adults, all right, and salt is number one predisposing factor that we can rule out. So it's advised that we reduce our salt intake.
Since we can't do without salt, it is good, and there's another disadvantage of it. Right. What is the measurement? How will I test it to know that if I continue to take it that way, it won't be harmful to me?
Okay. Well, what we advise is that when you're cooking, the amount of salt you should put, and when we talk of salt, we're also talking of the condiments. Okay. All right. Maggi, all the spices. Okay. Now, when you cook, when you taste the food, your taste bud must not be able to, perceive or identify that salt is in this meal. It should just be enough such that your taste bud, that there's something in there, that is not tasteless altogether, but you cannot also perceive that there's salt in it. that is what we advocate most times. That okay, put salt just to make sure that your taste bud does not perceive. By the time your taste bud begins to perceive that there is salt in this, then you're already moving towards increased salt intake. And then the other thing is that some people, apart from making the salt content very high, on the table they tend to add salt. Okay. That is suicidal, so to speak.
All right. What about the kind of cooking oil that is ideal?
All right. The kind of cooking oil that is ideal are cholesterol low oils. In fact, what we tend to advise is that they should be oils that are cholesterol free, and there are a lot of them in the market. All right. If our viewers go to the markets, they will see a lot of them there, and they write it there, no cholesterol or cholesterol free. Again, palm oil is a very good oil, and we are blessed with that here. All right. But then it is good only when it is not bleached. If you bleach the oil, it becomes converted. All right. And when the conversion takes place, of course, the reason why people bleach oil is so that it can, to a very good extent, look like or resemble granite oil. All right, fine. But then what happens is that the good portion of the oil, okay, gets destroyed and then converted to harmful oil. And at that point, taking it is very, very risky. Also, when you put oil on the table, if it solidifies, that oil is potentially dangerous. In fact, should not be taken. All right, you go to the market, you buy your palm oil or granite oil, and then you put it on the table for one day, and then for some it's even less than a day, and you have to put it on the fire to allow it to melt. Those oils are not good.
All right, you talked about lifestyle. This time around, we're talking about people who smoke. Are they really at risk, compared to those people who don't smoke?
Oh, smokers are at great risk. They are at great risk. Smoking tends to, of course, the reason why most people smoke is the reasons are quite numerous. Some smoke because of peer pressure. Some smoke just to feel high. But the truth of the matter is that the cigarette smoke affects the blood vessels directly. The cigarette smoke affects the heart directly. It is one of the leading factors that can be eliminated of cardiovascular disease.
All right, let's just move on so that you talk briefly on hypertension, because it is related to heart disease. Many people experience elevated blood pressure at some point in life. If you're diagnosed with high blood pressure, does that have any link with heart problem or disease?
Yes, definitely. If you're diagnosed with hypertension, what happens is that the heart begins to labor at a higher, to overcome the elevated blood pressure. The heart begins to labor more than it ought to. I'll give you an example. That's good. It's just like somebody who is carrying weight. All right. Now you need to put more energy to lift that weight, and that's what is happening. The heart is as if the heart is beginning to carry weight, and over time, if the blood pressure is not controlled, the person can actually develop frank heart problem, heart failure, cardiac heart attack. We hear of cardiac problems, heart attack, and things like that. It's actually
we seem to be running out of time. Thank you very much for being part of the program. We are grateful. We have been talking to Dr. AKINSANYA Olusegun-Joseph, consultant cardiologist at the Lagos University Teaching Hospital, about heart health. And that's all we'll take on this edition of Panorama. Please join us again next Tuesday for a fresh package. Good day.